able to effectively deal with the problems that we might have. So when a complaint comes in, you can go directly to the note, and with that, you can be able to trace the problem and come up with a solution immediately. Nurses have all received their training at the Barbados Community College and are well aware and can use the technology that will be available. The technology is going to be there, but there will be training sessions for all the staff so that everyone is capable of using the system as best as they can. We are envisioning a time where our nurses will be able to concentrate more on the patient, because a lot of the data, as the CEO have just said, will be already entered on the patient's note, and that repetition would not be needed. The plan for our nurses is to ensure that we have persons adequately trained to be leaders, to be trainer of trainers, and to be able to implement this system efficiently within the system, between the hospital system, between the organization.
All right, thank you, Shane.
There's another component of this whole nursing advancement. There's some new professions coming on in nursing, and Mr. Pinder could mention a bit more about that. The role of the nursing practitioner, which will be have a bit more responsibility. Mr. Pinder, maybe you can shed a bit more light on that role, which will fall into our hospital.
All right. Coming out of the compact with the Prime Minister, we were promised 30 roles. We already have some persons who are in the advanced nurse practice. We have our nurse practitioners and we have a nurse specialist. However, because of the dynamic nature of nursing, we now need to expand that number. And we are joining with the university to ensure that we have more persons trained as nurse practitioners. At this present time, we have 2 persons from the Queen Elizabeth Hospital who will be in that first cohort, and also 6 persons from the Ministry of Health. These practitioners will go a long way to improve the quality of care that is administered to our public. And for instance, in the accident emergency and at our polyclinics, these practitioners will be able to affect care 3. These are persons who would come to the accident and emergency department and may have to wait for a prolonged time because of the nature of their complaint. But with the training that the nurses will receive, they will be able to see them, treat them, and dispose of them in an effective manner. This, in sense, will ease the burden on the accident emergency and increase the throughput also in accident and emergency and the polyclinics that we have. The nurse specialists now, we have a number of them within the hospital already who are already practicing at a high level. They manage clinics, they see patients on the ward, they see patients on an outpatient basis, they educate the patients, they bring their knowledge to bear, and these persons have been well respected and have gained a part in the medical management of the patient. We continue to hope that more specialists will come into play, which will help to improve the quality of care we can discharge to our patients and help them to be able to have a better standard of care throughout Barbados.
Somebody who's listening to the show and they're thinking, what should my career be? Or what should my children's career be? Nursing's an amazing profession to be involved in. So not only are you a clinical profession, you're actually caring for patients, you're giving back to your own community. And we need to work, and I've spoke to Mr. Henderson about this, but how can we work to encourage more people to take up nursing? It's a job for life. It's not going to be taken over by artificial intelligence. The nurses are going to be here forever. So once you've qualified as a nurse and you're working in the different places in the hospital, as Mr. Henderson just said, you can specialise, sub-specialise and become a specialised nurse. Or you could take the management route and become a ward manager or an associate director, or even the future Mr. Henderson, a director of nursing. So it's a full career. It's an exciting career and a full career that you can go to. Our chief operating officer, nurse by background. Many chief executives, nurse by background. So it's a full career where you can get promoted and move forward if you choose to do so, or you can sub-specialise into certain specialist areas. And I think it's an amazing career, and I think we do need to work harder at encouraging the youth of today having a good look at nursing as a career for the future.
All right, we're going to take a break here on The People's Business. Do stay with us. We'll be right back. To have all of them in studio talking about what's happening with the hospital and certainly what the plans are moving forward. Before we went to break, we were talking about nursing and how that can be a game changer for even the delivery of service in one of the areas that a lot of people talk about, which is at the accident and emergency department. Moving around the world, as you have, you know that the physician's assistant position and many others are positions that assist in that manner and lend to the work that you do. What are some of these other positions, or what are some of the ways that these other positions will be able to tie into what you're doing, your overall goals for the hospital moving forward, to be able to get you a little closer to where you're going with the delivery of good service?
Yeah. So healthcare professionals are a limited resource, and it's always a challenge to recruit healthcare professionals. Therefore, having each of the healthcare professionals we've got working at the top of their clinical capabilities is where we need to go. So we don't want a nurse doing something that a nurse doesn't need to do and somebody else could do. And we want the nurses to work at the top of their clinical profession, doing the most clinical capable things that they're able to do. And same for the doctors. So there's many different ways we can bring in different staff groups to do this. But it's really important that we have good flow through the hospitals. And having the additional staff, and Shane mentioned just before, 10% more staff coming to the hospital. That's 253 new posts coming to the hospital over the next 2 years, with the majority coming this first year. And that's going to be a significant change for us and should help us really push forward with some of the changes that we need to see within the hospital. I know that many staff are tired. They're working shifts, long shifts. I know that sometimes they're having to cover additional shifts because of sickness. And that sickness could be because they're tired in the first place, so we end up in this cycle. Having the additional staff coming in should make that feel a little bit better. What Mr. Henderson tries to do, he tries to allocate his nursing staff to the wards based on the acuity and the number of patients in each of the wards. Our staffing ratio numbers are not where we want them to be. And having these additional staff will be very productive for us to support that. And I'd like to also pick up, because I know we need to touch this on some point, is the A&E. So the A&E department, there are some long waits in A&E. We know that they triage the patients when they come in to identify who's got the biggest clinical risk. and some patients end up waiting a long time if they're not on that top of the category for high priorities. Having the additional staff coming to the A&E department will assist that. And it's not just the A&E department that has the challenges. There are challenges then for the patient who's in the A&E waiting for diagnostics. And to address that, we're bringing 2 new pieces of equipment into the A&E department this year, a CT scanner and an X-ray machine. That means we don't have the challenge of trying to move the patient to the diagnostics department. The diagnostic department will be in the A&E department, and that will be enable better flow through the systems. We're also working at the moment to review the escalation plan. So when it's busy or busier than normal, how do we respond? We can't keep responding the same way, and we have to step up the services when there's a surge of patients coming through the department. I think what they've been doing in the past, they've got busy and they felt that surge in, but they've not had the information to say that surge is coming now. We know we're going to get busy if we count the number of patients coming through the door at any one time. And if they're used to 5 patients an hour coming through and it's gone to 10 or 15, we know we're going to be busy for the next 5 or 6 hours. And what we need to do is put resources down there at that time as the patients are coming in to address what I would call a bottleneck of patients coming through the system. To do that, they've got to have trigger points so they know when to respond, and then they need to know how to respond. So we've commissioned a piece of work at the moment that the team's working through, and they'll be working over the next 12 weeks to identify what are those different stages of the patient flow through the A&E department, and what are the bottlenecks that make it.
In the past, in the last presentation from the Prime Minister, she talked about additional funding for some projects. Does this lend to the projects that you're talking about as well directly?
Absolutely. So working closely with the Ministry of Health and Wellness, we've been seeking the funding to